Every year, Australian charity ausEE hosts National EOS Awareness Week to raise awareness for eosinophilic gastrointestinal disorders, or EGIDs for short. EGIDs occur when eosinophils, a type of white blood cell, are found in above normal amounts within the gastrointestinal tract. Eosinophils are an important cell in your body. It has many roles, including defense against parasitic infections and involvement in some forms of hypersensitivity and allergy. In some individuals, eosinophils accumulate in the gut, potentially in response to drugs, food, airborne allergens, and other unknown triggers. This infiltration can cause inflammation and tissue damage. If abnormal amounts of eosinophils are found in different regions, it is called eosinophilic esophagitis, eosinophilic gastritis, eosinophilic duodenitis, eosinophilic enteritis, eosinophilic colitis, and eosinophilic gastroenteritis. Eosinophilic esophagitis, EOE, is the most common type of EGID. The exact cause of EOE in most individuals is unclear. In some, it appears to be due to an allergy to foods and/or aeroallergens. The current estimated prevalence of EOE is 1 in 2,000 individuals and rising. People with EOE may have other allergic diseases such as IG, immediate food allergies, asthma, eczema, and/or hay fever. EOE affects people of all ages, gender, and ethnic backgrounds. In certain families, there may be an inherited genetic tendency. In its most severe form, EOE may cause scar tissue, called fibrosis, in the esophagus. The symptoms of EOE vary from one individual to the next and can include feeding difficulty, such as needing to puree foods and being slow to chew foods, difficulty in swallowing foods and/or regularly requiring a drink after eating, a food suddenly becoming stuck in the esophagus, called food impaction, nausea, persistent vomiting and retching, abdominal or chest pain, reflux that does not respond to anti-acid medication, failure to thrive, failure to put on or loss of weight. In other types of EGIDs, symptoms depend on which part of the gut is affected. Endoscopy with biopsy is the only way to confirm the diagnosis of EGID and EOE at present. The diagnosis cannot be based upon symptoms alone. A gastroenterologist performs an endoscopy by using an endoscope, a tube with a light and camera at the end, to look at the GI tract and take small biopsies. The esophagus may look visually normal, but when the tissue is examined under a microscope by a pathologist, an abnormal accumulation of eosinophils can be detected. It is also possible that the endoscopist could visually detect rings or furrowing, thickened folds, and white plaques. Eosinophils can normally be found in small numbers in all areas of the GI tract, except the esophagus. There is no cure for EGID and EOE, but the goal of treatment is to eliminate the eosinophils in the affected area, thereby alleviating symptoms and reducing inflammation. Treatment options for EOE include elimination diet or elemental diet, antacid medications or proton pump inhibitors, PPIs, corticosteroids, usually topically administered, and esophageal dilation. It is important to speak with an allergist, gastroenterologist, and have a dietitian experienced in food allergy before undertaking a diet. Treating specialists should discuss the treatment options with patients and families and tailor the treatment to the individual. We all live and hope for a cure. Funding medical research takes us one step closer. Please talk to a doctor about EGIDs. There is also additional info on the ausEE website. So what is ausEE's mission? ausEE's mission is to improve the lives of those affected by eosinophilic gastrointestinal disorders by providing support and information, and to campaign and raise funds for further research in Australia.